So good afternoon, members of the Fourth Estate. Welcome to our 42nd brief on coronavirus response in the country. Fellow Kenyans, welcome to our daily coronavirus update. Yesterday, we issued specific guidelines on how eateries and restaurants will be reopened. Today, we want to confirm to you that the protocols and management guidelines have since been uploaded on our website, and these can be accessed on www.health.go.ke. We encourage those interested in reopening their facilities to dedicate some time and keenly go through the protocols in order to be familiar with all the requirements before opening. On a related matter, since we first reported our first COVID-19 case, we have recorded many recoveries of our people who have successfully been treated for the disease and who have been able to go home. While we celebrate these recoveries, we are disturbed that reintegration has not been easy for these people. We have reports of stigmatization by members of the community for our recovered cases. And this is unfortunate, considering our constant appeal and massive education to ensure that people are accepted back in the community. Just this morning, fellow Kenyans, we had a briefing with one of our recovered cases from ICU, a gentleman who was able to recover from coronavirus disease. And as he was sharing his story with us, he's given us disturbing events with regard to how he's been accepted back in the community, issues and experiences that have not been pleasant for him and his family. And we need to appeal to you and to remind us all that the only way we can be able to beat this disease is if we avoid issues like stigmatization. Stigmatization will lead to fewer Kenyans accepting to be tested, and it will frustrate the efforts that we are putting on the ground to ensure that we flatten this curve. So we really do appeal for compassion in the community, for understanding, and even for celebrating these people who have been able to go through such a scourge and come out and recover. We do continue to appeal to our brothers and sisters to be considerate, to warmly welcome and embrace our people when discharged from hospital. And to this end, we are taking additional and deliberate steps to partner with patients who have recovered to spread their awareness. We are glad that the number of recoveries keeps rising day by day. And today, we've discharged an additional 5 patients, and this brings to the number of total recoveries 129. Regarding our COVID-19 situation, we continue to see a trend where we have new positive cases recorded primarily in Nairobi and Mombasa counties. While this may be indicative of the disease being domiciled in these 2 counties, it is also a pointer to the immense work that is required in Nairobi and Mombasa. And therefore, as we spotlight Nairobi and Mombasa and ensure that we enhance our interventions there, this is not a license for other counties to celebrate and to drop their guard. Rather, it is a call to action for the rest of the country to enhance the containment measures and to ensure that the virus is kept at bay and the curve is flattened. In the last 24 hours, we have tested a total of 508 samples from 14 counties. Out of this number, 10 tested positive for coronavirus, and of these, 9 are from Mombasa and 1 from Nairobi. This brings to total 384 total number of positive cases in the country. From the number tested, 284 samples were from Nairobi, while 89 were from Mombasa. All the 9 cases in Mombasa were picked from the community by our disease surveillance teams. And it is important that I emphasize at this point that indeed, from the data that we are synthesizing, we are noting that in the beginning of this scourge, we had most of the cases being imported cases, but right now, the tables have turned and most of our cases are coming from local transmission within our communities. And so our containment measures are quite crucial at this point. Each of the following areas has had 1 case: Old Town, Santana, Miritini, Bamburi, Mikandani, Kibokoni, Ganjoni, Memon, and Chuda. The Nairobi case is from Kawangware. As government, we have continued to partner with Mombasa County on containment measures to curtail the spread of infection, and we are organizing for additional and enhanced surveillance and management support for Mombasa County. We are also urging Mombasa County residents to rededicate themselves in this fight and support the county government of Mombasa and national government in helping to contain this virus. With regard to age distribution, today's 10 cases are aged between 12 and 63 years, and in terms of gender, 6 are male and 4 are female. We have also shared with you the current distribution of cases by county of detection and isolation, and this will be availed to you. It's important to note and maintain that Nairobi and Mombasa maintain lead with the highest number of isolated cases. We do thank you all Kenyans for your continued commitment in this fight, but we also would like to remind you to remember to be compassionate and to be your brother's keeper. Together, we will be able to beat this virus. And again, fellow Kenyans, the matter of stigma could actually take us behind if we don't work together and remember that we are our brother's keeper. At this juncture, I'd like to invite Waziri Wamalwa to give updates on county preparedness. Karibu, Waziri.
Thank you very much, ladies and gentlemen. And I'm here today on behalf of the Ministry of Devolution and Asylum and the State Department of Special Programs to appreciate the good work that our colleagues at the Ministry of Health are doing on behalf of national government, and particularly with regard to collaborating and cooperating with the counties. We've been working very, very closely, both levels of government, to deal with these situations, and indeed they have done a wonderful job. Today, I've come to engage them further to see how we can strengthen this collaboration, how we can also increase support to the counties, particularly those that are most affected. I'm very happy that from our meeting today, a lot is being done towards this direction of increasing support. And I was happy to learn today that more support is being given to Mombasa. As you have heard from the cases reported, Mombasa is a hotspot. And indeed, from the cases reported today, the highest cases have come from there. But a lot of support is being lent to Mombasa in terms of PPEs that already have been dispatched, and I'm very happy to note that support. We also want to say that though we have the COVID situation in the country, and we are dealing with it, it's not a local issue, it's a global issue. We also are in the same breath dealing with another disaster of floods. In the midst of COVID crisis, the floods are back with us. As you remember last year, we started with drought at the earlier part of the year. Then we had floods beginning September going into October. Towards the end of the year, we had locusts. Indeed, our nation is a resilient nation, but our resilience has been tested over the last 1 year. So today, as we speak, we have several counties that have been affected by floods due to the heavy rains that are ongoing. They have suffered landslides. You heard about West Pokot, Elgeyo Marakwet, Kipkelion, and other areas that have suffered landslides. As a ministry in charge of special programs, we have put measures in place to ensure we give support to all families affected. As of today, we have been able to dispatch over 40,000 bags of rice and other food and non-food items to over 24 counties affected by floods. What we are urging that the families affected need our support. And even as we give them humanitarian support, we want to urge the counties to comply with the guidelines given by the Ministry of Health in terms of social distancing. It might be a challenge where we have families displaced, gathered in schools, but we must still utilize the schools that are yet to be opened to create enough space and distancing to ensure that we do not, in the process of supporting or lending humanitarian support to families displaced by floods, also expose them to the coronavirus. We want to ensure that also as we distribute food, we are able to heed the guidelines given by the Ministry of Health. The protocols on food distribution have already been shared with the counties. And mine today is to urge the counties to heed those protocols. Even as we bring food to them, we want this food distributed through the county emergency teams, co-chaired by the governors and the county commissioners. We urge all leaders, including other politicians, to please work with the emergency response teams to follow the protocols even when distributing this food. As of today, the counties that I've said are affected are up to 29. And those that have lost lives, as we speak today, we have had over 116 lives lost to floods. We have also had over 100,000 households displaced. So we are urging that this humanitarian crisis that we are facing, even as we face it, let us work with the Ministry of Health and all the guidelines that have been given. So we want to thank you very much, Daktari, and urge that I think the country is happy with the updates, with the briefs that we have been receiving, but the counties are also urging that we would like to see you and CS Kagwe coming down to the counties to actually get to the ground and see the state of preparedness in each county. And on behalf of the counties, we'll be very, very happy to accompany you so that we get down to the ground, see the situation as it is in different counties and the state of preparedness, so that we see how to deepen and to widen the support and cooperation and collaboration between the two levels of government so that we can cushion Kenyans against this COVID-19 and the pandemic, as well as the floods and the locusts and all that are facing us today as a country. So let me thank you once more and urge you to come to the counties. Asante.
Yes. Tumesikia huo mwito na tutakuja. Thank you.
Yes.
Now over to questions.
One case that is at Kawara. Yesterday you did actually get 1 or 4 cases. I don't know what mechanism are you maybe planning to effect, particularly in those areas, because I understand the Kawara market is still operating normally. There are so many people at the market center. Maybe as a government, are you maybe planning to close up the market?
My name is from KBC. CAS, Dr. Mercy, I would like to find out on the challenges that the government is facing, because we've been talking about rolling out mass testing, and that has not, you're still doing the target testing thus far, and from what you can see from other nations, mass testing is really helping in knowing how many people are sick, and then they could consider reopening the economy or slowly easing those lockdown restrictions. And then the other point, the other question goes to the CS for devolution. Sir, probably as the CS, apart from the people who've been affected by floods, status of preparedness in counties on COVID-19, would you say that probably Kenyans do not require any kind of aid, because most people have been asking for support, especially on food and other basic needs?
The last one.
Yeah. Jimmy Mbogo from K24. Now my question is, out of the 129 cases that have recovered, do we have patients that already had existing conditions, and how many are they? Number two, CS Omalo has talked about Mombasa getting additional support. Maybe what kind of support are we looking at?
Great. Thank you. So I'll start with the first question from NTV with regard to the case in Kawangware. Indeed, the idea is that, yes, Kawangware now is an area that's under surveillance for us, especially after this first case, but also an area that is under surveillance for us because we have actually been monitoring with regards to adherence of the containment measures. And we've identified markets as one of the possible areas of transmission. If we look at the response that has been put in place by our different supermarkets, you can see that there's strict adherence to masking, there's strict adherence to use of sanitizers where necessary, and there's also adherence in terms of social distancing. I myself was actually touring the market this weekend, and I was able to see that in the marketplaces, some of these measures are not being adhered to. And so going forward, what we're doing is that we're going to deploy more surveillance teams. You'll be seeing all the different markets which have been marked as possible hotspots, having increased surveillance, having increased measures in terms of fumigation. We have a team that has come together with a schedule of how that will look like, but also coming up with innovative ways of how Mama Mboga can still continue with her trade, but ensure that social distance is facilitated. And I think this is an issue that we'll be able to elaborate on further. We do now have the call to be on the ground and to do those spot checks, and you'll be seeing most of us there trying to interact with the public and even have lessons as to how you can correctly put on a mask. Like I said, during the weekend over at Kawangware itself, I could notice people had masks, but they were on their chins. So these are some of the measures that we're going to be putting in place. With regard to Purity's question on challenges that we are facing, indeed, we've told you in past press briefings, there are challenges in trying to run a successful turn of a test. The tests that we are currently conducting are known as molecular tests, PCR tests. And for you to be able to do a PCR, after taking the sample, you have to run it through certain steps and mechanisms to be able to get your end result. Because of the global shortage, every time we get the kits, for example, you've seen we've gotten kits from Jack Ma, and even the Ministry of Health has procured kits. Every time we get the kits have certain components that come together to be able to do a successful run. And the greatest challenge that we are facing right now has been with the supply of nasopharyngeal swabs. We have had a series of interventions and meetings with different players to see how can we domesticate that swab to be able to ensure that it's actually utilized properly to correct the sample and to run a successful test. It's important to note, in terms of capacities, the country does have capacity to run tests. In fact, almost 37,000 tests a day, we can run them. However, it would require ensuring that we have all those inputs and components that go into a successful run for a test. Testing be as it may, we have sat down and asked ourselves, if we do not have enough supplies, what shall we do in terms of measures in ensuring that containment is upheld, but also ensuring that there's a surveillance mechanism. And so what we will be deploying shortly is what we are calling seroprevalence studies within the environment. So taking an area like Kawangware and asking ourselves, the population in Kawangware, have they come into contact with any coronavirus case? And if they have, are there antibodies showing that? And so there's going to be a serosurveillance prevalence study being undertaken. Thirdly, we've read and say Purity has a temperature, she has these symptoms, perhaps we need to focus on Purity and test Purity. So there are mechanisms we are putting in place to ensure that at the end of the day, with the challenges that we have, we still have a surveillance system that is robust. With regard to our 129 cases and their conditions, that's a very good question. We have a team of epidemiologists who are here with me today. We have Dr. Kuria here, who is heading the public health department. We are looking at our patients and segregating them in terms of their morbidity. So are you a person who has suffered COVID-19? Do you have diabetes? Do you have hypertension? Are you asthmatic? Do you have perhaps issues, that would be able to predispose you to the disease or affect your management? We have this data for you, and we will share it with you tomorrow. We'll also be able to give you a disaggregation of our severe cases, those who had comorbid states and those who did not. So this will be coming up tomorrow. We have that data. I'd like the Director of Public Health, Dr. Kuria, to elaborate further on the fumigation and the strategies we are putting in place in the markets. Karibu, Daktari. Fumigation.
Thank you, Madam CS, member of the Founder State. I would probably respond to this in relation to the case that is from Kawangware and any others that we may have picked up having turned positive from any of our estates in Nairobi and indeed in the country. What normally happens is that when a case turns positive, we send out our ambulances through their rapid response teams to pick up those positive cases. Another group then follows that team that does contact tracing around that case. Some of them who may have symptoms then are isolated immediately, and others would not. Sometimes we take samples for testing and advise them on the further quarantine measures. But on that particular area where I've picked up the case, we normally have another team that follows, that does fumigation of that area. And we follow up the following day with further contact tracing and further fumigation within 1 week. You may be aware that yesterday we handed over the management of health service in the Metropolitan to the Nairobi Metropolitan Service. And one of the issues that arose that we need to partner with them is what we have been doing in the quarantine centers and even where we have picked up patients, that we want to partner with them and make sure that program runs the fumigation, and furthermore expand that even to those areas that are called the informal settlements, that we increase our fumigation measures in partnership with the Nairobi Metropolitan Service. So yes, we do fumigation, and we continue doing that in partnership with the Nairobi Metropolitan Service.
Thank you. Thank you. Thank you all.
Thank you very much. As to the state of preparedness of the counties, I want to thank the governors across the country who have done quite a lot to prepare for this. And as we speak, all our 47 counties have each set up an emergency unit. As you are aware, His Excellency the President directed that 5 billion be released to the counties. This is going to help the counties build capacity. And I was just speaking to the chair, Governor Oparanya. They're in the process of ensuring that they are better prepared with what they have received from national government. And we also are releasing masks through our provincial teams. As of today in our meeting, we're discussing how, as we distribute relief food to families displaced, how we can also be distributing masks and sanitizers. And I'm very grateful to the Ministry of Health for the plans they have put in place through our county emergency teams to be in a position to ensure that even as we distribute food, we don't devolve corona to those camps and to the counties. So I want to assure Kenyans that a lot is being done to give that support to the counties. And from the Ministry of Devolution, we also have the Kenya Devolution Support Program. Over 4 billion will soon be released to the counties. And we are urging the counties to prioritize the COVID emergency responses in utilizing these funds to build capacity, to have more bed capacity. There are some that just need a few millions to be able to complete that. So this is the support we are giving them, and we want to assure them of continued support. But for the displaced, we want to assure Kenyans that we have enough food in the country, and we will be able to support all those who have been displaced so that they are able to receive this support. But even as we support them, we want to be cautious so that we heed the Ministry of Health guidelines. Thank you very much.